And where the new university was built, the present university, National University of Ireland, UCD, then was built, and that is where the sports ground was. And there was a dance there every Sunday night during the term. But there was very little drinking, and very few of the students, the male or female, drank at all, except maybe in the last 2 or 3 years, you notice, some of them were drinking.
Would you go to cinema?
Oh, the cinema was very popular.
Very popular.
Very popular.
Any drama?
They had the Dramatic Society, but very few of the medicals belonged to it.
Were there many female medical students in your time?
Yes, there'd be about 15.
Out of?
Out of 130.
So a very small number.
Yes.
Compared to now, yeah.
But I noticed also that the girls were much better dressed and had more money than the men. The men had the same coat, the same suit for 2 or 3 or 4 years, where the women would have different changes quite often.
How did your career progress then after that?
Then, in those days, you didn't have to do an internship, as I say, there was no such thing. So you could look for a post as a house physician or a house surgeon, or you could go into GP. And most of the students went into GP, and then you trained yourself in GP. You did went to a fever hospital, got a job in a fever hospital, got a job in a TB hospital. You did a diploma in public health. You did your LM, licentiate in midwifery, in Holles Street, the Coombe, and then you started to do locums for GPs, short ones, long ones, until you'd built up enough years of experience. You could then go and compete for one of the vacant dispensaries. And you know more about that than I do, but they received a paltry salary, very poorly paid, and worked very hard.
But they were much sought after.
Very much sought after.
Security.
Highly competitive. And then they'd like to get it, if possible, a dispensary near where they were born, where they came from. But if not, then they had the choice of 26 counties. Now, some of them went immediately to England and went into usually in parts of England or Wales that the natives wouldn't go for themselves, like the mining areas, Wales or north of England.
You didn't choose that path?
No.
No. You?
I then, when I got in the second year, I applied for a job in the Union, St. Kevin's Hospital, which is now St. James's, and it was the only hospital in Ireland where you had to have had a job in a hospital in order to get the job with them. So I had done a year or 6 months in Vincent's, so I got a job as a house physician in Kevin's for a year. And my job was with another young doctor, we were on duty from 1 in the afternoon till 1 the next afternoon. And alternate days would be on night duty and on other days day duty. And between us we served a 24-hour
shift.
rota. And we examined for were they midwifery patients, gynae patients, medical or surgical, and we would decide where to send them. And it was very good training. The only thing, it was self-training. You very rarely met a consultant. You were working in what was called the admissions room.
And did you read much, or did you just pick it up as you went along?
You picked it up. We read a lot, and we picked an awful lot up because we were exposed to clinically to an enormous amount of stuff. it served the whole poor of Dublin on that side, the south side of Dublin, south side of the Liffey, and they were exceptionally poor. The main thing you had to do when they came in, they had to have a bath. Most of the houses they came from didn't have a bath, and you had to bath yourself because you were often the lice would get up your sleeves when you'd be examining the patient. So we would.
Elastic.
That's right. We used to put elastic round the cuff of the white coat.
Keep them down.
And have a bath.
And did you have journals and books and all that kind of stuff? No journals, no?
You had to subscribe yourself, or go to the library in UCD, and they got the Lancet. They got the. We didn't get many journals in them, but they got the Lancet and the BMJ.
And was there a book that time? The book?
Not really, no.
Not really, no.
No.
So you kind of learned it as you went?
You learned it as you went.
Were there many drugs that time?
None at all.
None
no.
at all. No.
The only drug was alcohol, was Guinness.
Guinness.
Was the drug of all the ordinary people. Whiskey was only drunk by the upper class or middle class.
And were there many medications available to you that time?
It was all done from the pharmacy that you learned in the university. And we had a very good teacher of pharmacy, of pharmaceuticals, and very high standard. And it stayed with us because, you know, when you're young, that age, your memory is very good. So repeating it through that year, for a whole year, it stuck with us, and we could carry it in our head for at least 2 or 3 years.
So what did you have for infections? What antibiotics did you have that time?
It was sulfonamide. Penicillin didn't come out till the Second World War.
Yeah.
But we had sulfonamide was the main thing, and then antiseptics. Eusol was one of the antiseptics you applied to wounds, which was a solution of chlorine in water. It was EUSOL, Edinburgh University solution of lime.
I remember it.
Yes.
I think it's still around.
Is it still around? It's very good.
Did you have any, what did you treat arthritis with that time?
There was only one expert in arthritis. He was set up by the government. It was called the Rheumatism Clinic, and that was for the whole of Dublin. And he ran his own clinic. The ordinary hospital didn't have any.
Do you remember his name?
I can't remember his name. I only met him once, and none of us went to his clinic. He wouldn't allow anyone go. He was so busy dealing with hundreds. But his main prescription was aspirin.
Aspirin.
In very high doses.
12 tablets. You told us that, 12
yes.
tablets.
Yes, that's right. And also wrappings, splintings, how to splint and how to apply bandages for different types of strain or different types of joints. He used, I think, was supposed to visit the Union then, which was St. Kevin's, but I don't think he ever did.
And how did you get involved in rheumatology then?
Well, I then left there and I went to England. I went to, the first hospital I went to in England was in Liverpool. And in Liverpool, I went into a hospital that dealt with general medicine, gastrointestinal tract, dermatology, and these were the ones that were focused on, and the treatment of failures of people with cancer who had been with the radiotherapy and radium treatment and had failed, and the failed treatments used to go there.
What year was that about?
That'd be in the that'd be mid-50s.
Mid-50s.
And there they had a dermatology clinic morning and afternoon. Mondays, Tuesdays, Wednesdays, Thursdays, Fridays. And an evening clinic once a week. And as well as that, you had to be on medical duty every fourth night. So it was, some Irish men did their radiology degrees, postgraduate degrees, from working there. They went to the University of Liverpool. So from then I went to St. Luke's in Bradford, and I did general medicine and dermatology. Two very good physicians. You were very, very hard worked. As a senior house physician, you'd be on duty every night. One weekend in 3 off. And you did dermatology as well. The dermatology were mainly outpatients, but in Newsham, I forgot to mention that they specialised in the treatment of children with severe eczema of the scalp and face, and they used to give their own radium treatment, and they used to give their own exfoliation treatment, where they give the child medicine or tablets that would make the hair fall out.